This video, we're going to talk about 5 simple tips to get accepted into a nurse anesthesia program now. So definitely keep watching. My name is Christine and welcome to a new video. If it's your first time here and you want to become a CRNA or grow your CRNA career, start now by subscribing and hitting the bell so you don't miss anything. So today we're going to talk about what are some tips to get accepted into a nurse anesthesia program. These tips are pretty simple, and I feel if you just follow through with your dreams, sacrifice a little bit, work hard and be patient, you can do anything and you can get what you want, but you got to be patient. So definitely start thinking about that. So the first thing I recommend is trying your best to get right into the ICU environment. So if you're currently in school for your bachelor's of nursing and you're about to graduate, definitely try to get your foot in the door right into the ICU as soon as possible. I feel the more ICU experience you have, the stronger skill set you'll have. I also think that, of course, there's many variations within the ICU environment, but a lot of my classmates, a lot of the people I've spoken to who are currently CRNAs, they've done specialties in surgical ICU, medical ICU, cardiovascular ICU. A lot of people from cardiovascular ICU have a lot of strong pharmacology background, so I feel that's a really great thing. While, for example, for surgical ICU nurses have a strong understanding of different type of surgeries and different type of skill sets in regards to that, in regards to ICU critical care, as well as when you do transition yourself as a CRNA. Now, for me, I was a medical and surgical ICU nurse. First, I was in the surgical ICU environment my first year, transitioned into the medical ICU my second year, and then at a point I started floating between all the different disciplines. I was in surgical ICU, I was in the medical ICU, once in a while I may go into cardiovascular ICU, but for me, I really like the medical ICU environment. I really got to see a lot of different comorbidities, pathophysiology, a lot of different conditions, and also the relationship with that with critical care medicine and pharmacology, which is very unique and I feel is very important. Now, there was different types of, for me, I worked in a big teaching institution. So we got a lot of sick patients, we got a lot of variety of patients with very rare disorders, which was really cool and exciting for me. And I knew to myself that I just love critical care medicine. At one point I wanted to become an acute care nurse practitioner. But for me, when you're thinking about your ICU experience and trying to get into ICU as soon as possible, it's very important to get that experience and really get involved into it. So that's very important to think about when you are going as an ICU nurse. Now, so you're in an ICU environment, I really recommend to after you transition 3 to 6 months into the ICU, depending on if you are a graduate nurse or maybe you're from another area, maybe you're in medical surgical unit and you transition into the ICU, I recommend being involved on your unit. Try to be a part of quality improvement measures, try to be a part of research, try to be a part of committees. Also think about this too, of course being involved. Like say an example, can't be involved in your institution, maybe try to look at different avenues outside of the hospital. Definitely being a part of community service initiatives, maybe be involved on your nursing organization, association, try to be involved in that avenue, as well as some critical care, things. So now, for example, I'll give you an example because I want to give you examples. I think that will really help you. So when I was at NYU Langone Medical Center, I learned about this program called SARP. It was a substance abuse research program. And so I got involved in it. I applied for it, got accepted. It was different nurses, dentists, doctors. And so I did that. So I got involved in that. I did it during the summer between when I was in school. I had like a summer break. So I basically focused in on that during the summer. And I did research. I learned a lot of different pharmaceutical, research techniques. I learned how to make a poster and I learned how to analyze the data. It was a really good experience for me. And I worked with pharmacists who were specialty in research, which was great. I thought I had a really good experience doing that. Another thing I was involved is on my unit. I was involved in quality improvement measures. When the first this was like years ago, there was something called sepsis and sepsis champion, and that's when it first started to be talked about. And I became a champion on my unit, and I tried to be involved on quality improvement measures, and I even was involved on the nurse resuscitation committee, and I went to all the meetings, and I was a recorder, and I really tried to be involved in that avenue at my hospital. And then so I did that to prepare myself and get myself involved. Now another thing, saying for example you can't do those type of things, maybe start taking some classes for nurse practitioner or just in advanced practice nursing classes to get yourself in the mindset and get good grades on those courses. So for example, I would recommend taking maybe a research class, taking an anatomy physiology class, maybe taking a pharmacology class, maybe a pathophysiology class if you're, in advanced practice nursing, and just get some things under your belt and get good grades, because when you're thinking about a CRNA, a nurse anesthesia program, when they're looking at your resume, they're like, wow, she did really well. She took some advanced practice nursing classes, and wow, she did really well in those classes. That looks really good. Maybe there were some classes that you took when you were when you were going for your bachelor, and you maybe didn't do as well. But showing that you can take advanced practice nursing classes and do well, I think that looks really good on your resume, and that's a really good tip that I would recommend for you to do. I felt that helped me a lot because I was in a nurse practitioner program before I decided to go into nurse anesthesia, and I did very well in my classwork. So I feel that really helped strengthen my resume and my application when I was applying to nurse anesthesia school. Another thing, so definitely same example, you get accepted for an interview. Yes, you may have the grades, you may have all these activities under your belt, but interviewing skills is essential. You really need to know how to, act during an interview, being professional, really knowing your information. Because you may have your critical care experience, but maybe you don't know the drugs, you don't know the mechanism of action, maybe you don't know a lot of the critical care medicine that you need in order to pass the interview. Because the interview is not just to talk to you about, your experiences and stuff. They're actually going to test you in a lot of the knowledge. So these are some things you got to think about when you think about interviewing. You really need to know how to answer pathophysiology, pharmacology, anatomy physiology, airway management techniques you've learned in the ICU, ABGs. You really need to know a wide spectrum of critical care information. So I recommend, when you do decide to take your critical care certification, that information, that knowledge that you have to know to basically take that exam and pass it, that's the same information I recommend you studying and really understanding. Really understanding your drips, really understanding your drugs, maybe understanding your ABGs. A lot of the main principles of critical care medicine, you really need to know that, to really do well on your interview, because you may have everything going for you, but if you don't do well on your interview, you're not going to get accepted. And that's just the core of it all. And I want you to be strong, and I want you to be a very strong applicant when you go for your interview or to go to become a nurse anesthetist. So I definitely have videos, tips and tricks, as well as a lot of different examples of questions that they may ask you. So definitely check out those videos. Another tip would be making sure that you keep your options open. Make sure you're not just applying to one school. Yes, you may say to yourself, I want to go to this one specific school because X, Y, and Z, but I really recommend that you apply to multiple schools to keep your options open and rate them from the one that you want the most to the one you may not want the most, but you're still willing to go to. Keeping your options open is always a nice thing, because if you get rejected on one school, maybe it's a school you really want to go to, but then you got another school that's really great and you wanted to go to there as well. It's good to have options, so you don't, you're keeping your options open, because at the end of the day, you want to become a nurse anesthetist. When you have your application, for example, when you graduate and you are a nurse anesthetist, they're not going to really, yes, it's nice you maybe went to an Ivy League school, but it's not really, you're a nurse anesthetist, you pass your boards, and your experience is a big thing, or maybe, it's such a shortage in nurse anesthetists across the country, and that, when you graduate from nurse anesthesia school, you're going to have so many options to get accepted. So, try not to be too, focused just on one specific school. Definitely keep your options open and applying to multiple schools. So if you want to learn more about CRNAs and how to grow your CRNA career, definitely click one of these videos over here, and I'll see you in the next video. Thanks for watching.